what to do if your friend cut themselves and there was still an object left in it?
You've got to get it out!
No! It's really important to make sure the casualty does not pull the object out, as it could be stemming further bleeding. Get the casualty to sit down as they may go into shock. And the key to any blood wound is pressure and elevation. Now obviously there's an object in it, so we don't want to put direct pressure on the wound. So what I'm going to do is show a simple technique for putting indirect pressure using bandages out of your first aid kit. Remember to wear gloves when you're dealing with a blood wound for hygiene reasons. Remember to wear gloves to minimise the risk of infection. Now what we're going to do is we're going to pad the object with 2 bandages very carefully, and then we're going to ask the casualty to just hold those in, just to add pressure as much as they can bear their pain threshold. Then you're going to grab another bandage, and we're just going to use this to gently pad either side of the object, being very careful. Can you let go? Thank you. Not to push it down on the object. And then simply we need to wrap either side of the object, being sure each time to add pressure either side. The reason we are doing this is because the pressure will help the blood to clot, and we're also minimising the risk of infection and hopefully making it a little bit more comfortable for the casualty before we get them to the hospital. Make sure you monitor the casualty all of the time whilst you're doing that, in case for signs of shock. Then what we're going to do is we're just going to do a simple knot on the top, like so, for added pressure. Then, as I said earlier, the key is pressure and elevation, so we just ask the casualty to raise it, to keep it elevated, and then we'll get them to hospital.